Hello and welcome all. I thought I'd talk about Australia and COVID-19 and the timeline of inefficiency. So, firstly, COVID-19, it's not just the flu. With the seasonal flu, the average hospital stay is around 5 to 6 days. The death rate, in America at least, is around 0.1%. And it's a known virus, and there are vaccines available. With COVID-19, for every person infected, 2 to 3 additional people can also be infected. 20% of patients are serious enough to be sent to the hospital, and in hospital, the average stay is around 11 days, so 5 to 6 days longer than with the seasonal flu. The death rate, it's even higher too. It's around 2 to 5% depending on the sources, and the incubation period is around 5 days average and goes up to 11 days depending on the source. And basically what that means is that someone can be infecting someone for 5 days, 5 to 11 days, without even knowing it. And most importantly, it's a novel virus. It's unresearched and there is no vaccine. So the most critical thing about any of these pandemics is exponential growth. Basically, you can see that it started off relatively flat, and as time went on, boom, it just shot up. So looking at diagnoses in states and territories over time, we can see that New South Wales has had a massive surge. It's gone from 0 cases all the way up to over 450. Victoria and Queensland are experiencing the same thing, but they're just going up a few days after us. Same with Tasmania and WA. And then we got the timeline of COVID-19 in Australia. Basically on January 21st, we had the first warning in Australia for new coronavirus. On January 25th, Australia records its first case of a Victorian Chinese man in his 50s. February 5th, Australia announces a 14-day ban for non-citizens arriving from China. March 2nd, we had our first death. It wasn't until March 13th that we started to ban people from indoor gathering. At that time, it was 500 people. And that actually started on March the 15th, because the Prime Minister wanted to go to his football game on the Saturday, and he also wanted to go to the church session on the Sunday. And then March 18th, we got the ban on indoor gatherings of more than 100 people, and a level 4 travel ban, the highest travel ban you can get. In March 21, Australia cases passed 1,000. March 22nd, as of today, New South Wales, ACT and Victoria to shut down all non-essential services. So if you look at the timeline in correspondence to the graph, around March is when it started to peak. So March 13th, around here, that's when he started banning 500 people, and by him I mean the government. March 18th, that's when that 100 people here, but by this time we're kind of past the point of no return. Exponential growth has already started. So, business as usual. Our Prime Minister has been saying that everything's going alright. The problem is that we had really high testing criteria to start with, and it required 4 strict criteria basically to be met. So, international travel within the last 14 days, close contact within the last 14 days before illness onset. A lot of people didn't even know if they were in close contact. The incubation period, remember, is 5 to 11 days. On average. Fever, acute respiratory infection, e.g. shortness of breath. The schools remained open. There was a slow lockdown and closures, panic shoppers buying all the toilet paper, everything that they could need in a quarantine. And most importantly, I think there was mixed messages from the government. Over the last 2 months, they've been saying business as usual. We even had the Prime Minister saying that he was going to go to an NRL game on the 14th of March. There's also been a massive disregard for the public health messages because people are confused. People don't know what's going on. There's been mixed messages. And there's new information every single day. So rather than just putting the foot down and quarantining or stopping everything from the start, the economy has been king for our government. So the most important part going forward, though, is going to be the stress on the Australian healthcare system. Australia has just over 2,200 ICU beds. With an infection rate of about 20%, 254,000 Australians would require intensive care. That would put a strain on equipment numbers, respirators, ventilators, and personal protective equipment. And there's already a strain, we can see it. And just think about the exhaustion of health workers and then the public. This is going to go on for months. You've got these health workers who are working in high stress areas. You've got the public having to listen to corona for the next 3 to 6 months, perhaps next year. And there is definitely going to be a global shortage of medical equipment. Everyone's ramping it up, but that's a big problem. So the most important thing going forward, and this is why they keep stressing it, is that they want to try and flatten the curve. At the moment, with exponential growth, we're going to exceed the healthcare system capacity. But if we can extend the times between the cases, we can actually cope. But at the moment, it's quite worrisome, because if we keep going on the trajectory we're going, our healthcare system is not going to be able to cope. And lastly, I just want to talk about Australia versus Italy. I would talk about Australia versus China, but I do not think that the stats that are coming out of China are accurate. They just miraculously stopped at 80,000 cases, gone up to around 81,000 in the last week or so, but they've done supposedly really well. So Italy at the moment is the new epicenter of coronavirus. In Australia, we have around 3.9 beds per 1,000 population in public and private hospitals, and around 3.5 physicians per 1,000. In Italy, they have 3.2 hospital beds per 1,000 people, and around 4.2 physicians per 1,000. So we're pretty similar, but they're struggling. And you can see the amount of cases they have. They're up to over 40,000. I think they're up to around 50,000 of time for making this video. And we're only at around 1,000, 1,300. But you can see with exponential growth, it does stress the healthcare system. So we really have to be careful. And that is why listening to health officials is very, very important. So that's it for this video. Thank you for watching. Hope you learned something. Be careful with misinformation going forward. Stay healthy, stay safe, wash your hands. Try and get most of your information from the government in terms of the health websites. I'll post some links down below. And that's it. Thank you.